we get a lot of different diagnoses. We get a lot of neurological people with strokes, Parkinson's, MS, all sorts of things like that. We get some orthopedics, hip fractures, knee replacements, hip replacements, and then we get a lot of general medical people who just come in with just some general, they fell, things like that, just general weakness. But their goal is to go home, so they come for rehab.
What used to require hospitalization doesn't have to anymore. And it goes both ways, whether it's taking in somebody from the hospital because they're coming for rehab, whether they need to complete an antibiotic, whether they've had a heart attack and they just need the rehab to get stronger. Or if you have a patient who's here who suddenly gets pneumonia. Well, a couple of years ago, that person would have been sent to the ER. You don't have to anymore. We can manage all of that here, so they get to stay.
We want them to maintain where they're at. We never want them to lose that function that they've gained. So, we try really hard. We look at people several times a year, just on a regular basis, regardless of if anything's changed or not. So, in addition to occupational and physical therapy, we have a speech therapy staff that looks at feeding, swallowing, and cognitive therapy. So they work with both OT and PT as well to give us another aspect of how to treat the residents and as best as we can. We just try to be as creative as we can with function and just focusing on what do you need to do to go home, and you're being creative and using what we have to make it more like the home environment.
This isn't the road that people want to choose or envision themselves in choosing. This is the road that they have chosen because of where they're at this point in time. And the fact is, they may not ever be able to go back on that other road that they passed up the first time. And we want this road to be as conducive to providing a quality of life that affects not only the patients but the family members as well.